Good morning, everyone. I'm Melissa Blasius, ABC15 investigative reporter. This is the ABC15 Town Hall on the winter resurgence of COVID-19. Thank you so much for joining us for this live stream. I'd like to introduce who's here with me today. First of all, ABC15 data guru Garrett Archer, who very closely every day watches the numbers as they come in on cases and hospitalizations for COVID-19. Then Dr. Sam Durrani, who's Vice Chief of Staff at Honor Health, the Deer Valley Medical Center. Thank you very much, Doctor, for joining us, as well as Will Humble, who is the former State Health Director in Arizona. So thank you very much for joining us. Let's go right in with the numbers, Garrett. Where do they stand today? And is this the highest daily totals that we're seeing at this point?
So yeah, 346,000. My machine decided to stop working, but 346,421 cases, 5,442 reported today. That would be a record if not for the 10,000 that were reported a couple days ago because of the Thanksgiving delay. We also had new death reports of about 82 new deaths. That does bring the death average, the 7-day death average, to about 36. That drags it upwards. And our 7-day average is at a high as well at 45.85.
So tell me what that means. I mean, obviously we're at some sort of maybe a peak, but there's no sign that we're going to go down after this point.
That's exactly right. All we can tell right now is that we are surpassing the peak right now of the summer surge, if you will, the summer peaks. We are passing that right now. And that has a lot to do with, of course, the much more testing we're doing, but also our percent positivity rates are much higher than they were, say, in September. We're now looking at positivity rates in the double digits in almost every county consistently every day. Right now we see no signs of abating, no signs of leveling off in the case numbers. And of course, because hospitalizations and deaths and everything else lag the case numbers, we don't see any leveling off in anything right now. That's really where we are. And we won't really be able to get a good feel of what Thanksgiving really did to these numbers until sometime middle of next week, because it takes about 10 to 14 days for any sort of event to really fully materialize in the data.
And as we're talking to you, Garrett, I wanted to remind our viewers, if you are watching this on Facebook, you can put your questions or comments down in the comment section below the video window, and we will try to take as many as we can during this live stream. So we've talked about seeing numbers higher than our summer surge, our summer peak. Let's go to Dr. Sam Durrani right now. And Sam, what are you seeing at Deer Valley Medical Center? Are you seeing a worse situation than you saw in July?
Well, right now we're running close to capacity, almost at capacity. Now we're seeing that throughout the network, throughout the valley, that we are at capacity. Now that's pretty normal for wintertime, except we don't have an excess of COVID patients in a normal year. So right now, about 25% to 30% of our inpatient census is COVID-19 patients. So that's going to put a squeeze on the other patients that are trying to get care at this time of year. We'll have to start shuttering surgeries that are necessary, right? People need surgery at this time of year. People's deductibles are up. So you're going to start seeing more and more of a squeeze on our resources as patients come in and our ICUs fill. We still have these sick people on the other floors, right? So if our ICUs are full and those patients that are on the floor that we're watching get sicker, they crash, we're talking about now overflowing capacity. And that's when we start getting into rationing care, crisis standards of care type situations. If our ICU is full, we're still a trauma center. If you get into a car accident, we need to have a bed available for you. If they're all taken, that's where we have to start making some difficult decisions, and why this is such a big deal. Mortality will increase, and it's important for people to know, not only for COVID patients, but overall excess mortality will increase dramatically, much higher than it normally would.
Wow. I know that you've been you did some rounds at the hospital on the COVID floors recently. Are you seeing that people are, we get this impression, or we've been told by certain officials, that people aren't getting as sick, that the therapies and the drugs are working better. Are you seeing that in reality at the hospital?
I think we're admitting a lot more sick people. We let a lot more people go home. The patients that are in our step-down units and are very sick, okay? So for example, ventilators, our COVID patients, once they're on a ventilator, they're in the ICU, okay? Normally, in a normal year, if you're on 100% oxygen and high flow, they're blowing air into your lungs, you would be in the ICU and we'd be watching you in the ICU. But since you don't need a ventilator, and ventilators, are at a premium, the ICU beds are at a premium, we're going to watch you on the floor where the nursing care is, the ratios are a little bit, 1 to 4. So basically you have higher level acuity patients on floors where they weren't normally before. I hope that makes sense.
That does make sense.
Yeah.
Will Humble, let me turn to you and ask you a question about how things are going. The governor yesterday announced some minor mitigation steps and encouraged local authorities to enforce more of what mitigation is already there. But this falls far short of what the researchers on the COVID-19 modeling team at the universities were asking the governor to do. They thought that there should be a statewide shutdown, and a number of the major hospitals wrote a letter to the state also asking for serious mitigation measures, a curfew, as well as not allowing groups of more than 25 to get together, and shutting down indoor dining in restaurants. How concerning is it that the governor and the state health director are looking at that and saying that it's not time for that yet?
Well, I mean, here's the thing. So much, and we were talking about this before we started on the show, time is such an important factor when it comes to these interventions. And so if you remember the crisis that we had in July, we were able to squelch that crisis by shutting the bars for a number of weeks and having restaurants to go to 50% capacity and so forth, and allowing the cities to have face covering ordinances, which they did right away. And so that combination of interventions worked over the course of weeks to drop the caseload down and the hospitalizations down in September and October. And in my view, the big mistake here, when you do a root cause analysis of why we're in the position that we're in, is that when the businesses were allowed to reopen, those bars, restaurants, and nightclubs, they were required to put in some mitigation measures that were good. I mean, they're good mitigation measures. The problem was that there was never a proactive enforcement system in place to ensure that when they did reopen, that they were doing it in accordance with the attestations that they made, that they follow the mitigation measures. And over the course of many weeks, businesses, as you could see, I mean, you could go anywhere in town, around the state really, and take a look on weekends and see place after place that are not following the mitigation measures. And because the enforcement wasn't in place for those months, we ended up with a continuous escalation in cases, in part. I mean, that's just part of the equation, but it's a big part. And so the reason I wanted to set the stage with that discussion before talking about where we are today. Now we've missed all those weeks and months of opportunities to do enforcement of the mitigation measures. And it's brought us to this place where we are. Dr. Durrani just talked about it within the system, where we're already at capacity and it's only December 3rd. So we're facing a big crisis in the next 2 weeks. And because we waited so long to put in mitigation, to enforce the mitigation measures, we're now in a position, I think, as an elected official, you're now forced into a position of either accepting the fact that the hospitals are going to be at overcapacity and going to be operating under the crisis standards of care, which Dr. Durrani talked about in terms of triage and so forth, or you have to do something much more dramatic, which has this big economic impact. Like, for example, like shutting bars completely again. And having restaurants back to take out, but we don't have the federal support for unemployment insurance anymore. So that's why it's so disappointing that we didn't have rigorous enforcement of the mitigation when the pause ended in July.
And Will, let's talk a little. I mean, obviously, the governor has some very difficult decisions to make because, if you were to close down the state this month, you would literally be laying off thousands, hundreds of thousands of people potentially right before Christmas. Some small businesses would never recover from this, especially since what we don't have now is that same federal infusion of cash and loans and unemployment assistance that we saw in the spring and early summer. So what is your advice maybe to people out there, right? Because and there's some common sense measures, but that the governor's talked about: washing your hands, wearing your mask, socially distancing. But what is your advice to actually people who are trying to decide, is it safe to go out to a restaurant for to meet a couple friends for happy hour? Is it safe for me to go down to the local store and pick up some Christmas presents?
Yeah, so the messaging that we've had, the whole public health system and the medical community over the many, many weeks has been about, making sure that you are making smart decisions when you go out into the community. Make sure that you wear a mask. Think carefully about, do you really need to make this trip or not? And that has, I think, right now, a much more personal meaning to people. And here's what I would say to answer your question. I'd say, look, getting infected with this virus in September and October was one thing. But if you get infected in December, God forbid that you need hospitalization in mid to late December. So I'm just saying, think really carefully about what you're doing, because if you get infected with this virus and you're one of the unlucky people that need to be hospitalized, you will be in a very, very challenging environment in December, because the healthcare workers that will be attending to you will be exhausted. The system will be overloaded. And quite frankly, I think they will be forced into using the crisis standards of care probably by December 15th, if not for sure by Christmas. And what that means is there's different levels of triage, different levels of care. And Dr. Droney can talk about this maybe. They've probably done the homework now about how they're going to have to score patients and decide who might not get care at all because of where they are on the SOFA scale. That's the risk for multi-organ system failure. Or if they were to recover, how many years of life would they have anyway? And I mean, honestly, that's what crisis standards of care is. And so if you're going to go out into the community and risk getting infected now, that's way different from the decisions that you are making in September and October at a very personal level.
Dr. Durrani, did you want to address that? Is that basically what it is? There's a scale where there's a hierarchy of who will get care and who won't?
Yeah, so he touched on a couple points, right? So during the surge in June and July, our mortality rate in the ICU was in the 40s for COVID-19 patients, 40% range. Means 4 out of every 10 patients that were admitted to the ICU died. Okay, we've looked at our data for the last 2 months, and we've been able to reduce that rate to between 2 to 3 patients will die. Now that's gonna go up significantly when we're strained. The other question that about the ethics panels, right? They have to be in place. I mean, these decisions are very, very difficult. Nobody wants to be on an ethics panel, but these tough decisions are going to have to be made, right? And you heard about this during the days of Obamacare, right? Death panels, groups of physicians, and it's very morbid ethicists that decide, do you have a quality of life ahead of you, or are we going to, give this staffed bed to someone else? It's really tragic to think about happening in our city. It's very sad.
Dr. Durrani, are you seeing an influx of nurses come into Arizona and other medical workers from other states? Have we been able to get in excess of staff at your hospital?
We're competing against an entire nation that's surging, right? Our staff is already stretched to the limit. We've been infused by money from the government to try to compete against places like Texas, where they're paying a lot of money for nurses. This issue that Dr. Humble brings up about mitigation and things like that, mitigation is something that should have been done 2 or 3 weeks ago, in our opinion. You have $80 million that you've infused into the healthcare system. If you had mitigated appropriately a month ago, you could have taken that $80 million and given it to small businesses to help them, to shut out, indoor dining. Indoor dining, we know how the virus spreads. It spreads indoors when you're not wearing a mask, okay? If we could shutter those businesses while supporting them financially, then that would have been the way to go. But now it's all like a cat's already out of the bag. We are gonna be in a disastrous state here in the next 1 to 2 weeks. That's something that Ducey recognized. He said the next 1 to 2 weeks are going to be very difficult for Arizonans. He's absolutely right about that. The other thing I'll bring up briefly is something as simple as a mask mandate. We don't understand why this is like a badge of honor for Mr. Ducey. Why is it so hard for him to say everyone wear a mask and make it a mandate when we have people from Scottsdale that are confused because Scottsdale doesn't have a mask mandate, but Phoenix does. And I know it goes down to the county, but the messaging becomes very confused. So these are type of things we don't understand as healthcare professionals, why simple things like that somehow seem like an issue or a source of pride.
Melissa, can I jump in on that mask piece real quick?
Sure.
Here's the thing about the mask mandate. I really believe that number one, we knew back on, I think it was May 23rd, when the National Academy of Sciences put out their initial report that showed that face coverings were super effective, the number one return on investment intervention that we have. And yet all these months have gone by without using the best tool that we have that has essentially zero cost. Think about that. Leaving on the table a public health intervention that's free, that has the potential to make a huge difference, and not doing it. Now, they finally allowed the cities and counties, and there's this hodgepodge of ordinances across the state, but virtually all of those ordinances are individual mandates on individual people. I've been advocating for a statewide face covering mandate, but one that focuses on businesses and charges the businesses with the responsibility that their customers are going to be wearing masks when they're in their facility. So, for example, hardware stores would be required to make sure that all the customers are wearing masks rather than having the mandate on the individual people. I mean, when we did the Smoke Free Arizona Act back in 2006, it wasn't a mandate on, like, if you smoke at a restaurant, it's not the individual person that gets in trouble. It's the restaurant, it's the bar, it's the facility. So we need to have a mask mandate that leverages merchants to ensure that compliance happens, and have it be statewide and uniform. Had we done that a long time ago, I think that would have been a game changer. But here we are, and we've lost all these weeks and months of opportunities for that mitigation measure.
It's interesting, if you look at the letter from the CMOs that went to Ducey yesterday.
And say those are the hospital managers. Yeah.
Correct. The hospital managers have given up on the state mask mandate. They thought that if they gave a little bit on their side, that he would have closed indoor dining. So they had just given up on that, on trying to convince them. That's why they left that out.
Okay. Let me change the subject a little bit, and we might come back to this, but I wanted to have Garrett tell us a little bit about what's going on with the school's dashboard. So there is, explain a little bit about what the dashboard is, and then there was an update this week, Garrett, this morning. What did it show?
So the school's dashboard is something that Maricopa County puts out every Thursday morning. What it does is it uses the county's compliance systems to basically put every jurisdiction, whether it's city, elementary school, unified school district, high school district, or zip code, and it puts them into a category of minimal, moderate, or substantial. based off of similar criteria that the AZDHS puts out. However, unlike the AZDHS, they actually will recolor their data based off of only 1 week and only one metric. So it gets a little more, I guess, accurate. It depends on what you want to say of what's moderate and what's substantial based off of all of the metrics rather than just one. So let me just show you this really quick. I can share the screen and show what this district map looks like. Anyone can go to this at gis.maricopa.gov/COVID/schools. And this is basically showing where our school districts are. This is the elementary school districts. This is the high school districts. You see all high school districts in Maricopa County are in the substantial. The unified school districts, more of the suburban districts, and they are all, again, almost all of them are in substantial. In fact, the only ones that are not, Fountain Hills, for example, are only not in substantial because they need 2 weeks of cases per 100K, and they're only at 1 week right now. So that will probably move into substantial by next week. And then, of course, as I said, they also have cities and then zip codes. So this, as you can see, there's very few. If you looked at this, if you've been following Katie Randall and I do this on a regular basis, and there was a time when there was only about 3 or 4 substantial zip codes in the entire state, or county, excuse me, back in September. And in fact, we were starting to try to figure out when the minimal transition to zip codes were going to start coming and where they were coming from. Well, obviously, everything else changed, and you can see there's now very few moderate transmission zip codes left. And if you know Maricopa County, you can know that these are very rural areas. No one lives in these areas. And this right here is South Mountain, and this right here is over by the Fountain Hills where no one lives. So again, very low population, moderate, but everywhere else in the county is community spread. And I'm going to show you one last picture before I move on. This is from an analyst colleague of mine that we collaborate on Twitter. And this is the same map for unified high school districts and elementary school districts. However, it is done using a gradient system. And so you can see really what the case per 100 rate is in all of the unified school districts and the elementary schools. And what's interesting about this particular spread this time around is it's really emanating from the East Valley. But when we first in the summertime, this was a hotspot of the southwest Phoenix. Now it is emanated from really the East Valley. There still is some hot spotting going on in southwest Phoenix, but really, like I said, very different from this time. And that's why, for example, that area is a very suburban area. And today, the demographic white non-Hispanic has surpassed the demographic Hispanic or Latino in the number of cases, and they hadn't surpassed that number since June 2nd. Was the Hispanic number had been higher since June 2nd. So this is a very different surge, and it's very community spread at this point. It's not really the same with just one hotspot. It's coming from everywhere at this point.
All right. Thank you, Grant. I did want to follow up a question from one of our viewers saying, when we talk about traffic deaths statewide, heart attack deaths, etc., that we don't make people wrap their cars in bubble wrap. I just wanted to talk about where the coronavirus deaths fall into state fatality rates. Garrett, do you have some numbers on that? I know it's something you've been looking at. Will Humble may also know where we kind of stand versus those things.
I do have those numbers, but not on hand at the moment. But I can tell you that, I can tell you that right now it is basically increasing and will likely be one of our top specific causes of death here, coming up, if it isn't already.
Sure. And in fact, I actually looked at those numbers this morning, and the top 2 causes of death in Arizona are heart disease and cancer, and they're about 12,000 deaths a year. So if you think about that, what's the number on deaths today? 6,000.
We are at 6,800, and unfortunately our average is climbing. So we're going to start adding 30 or so a day here on out for the foreseeable future, because deaths are the ultimate lag. Sadly, obviously, from case to death for a case that does pass away, average of 28 days. So, right now, as cases continue to rise, that death number will also correspondingly rise. And if we do see a break in cases, that break in deaths is not going to come for another, 2-3 weeks after that breaking cases.
But Garrett, overall excess deaths will also rise. So what he's talking about with car accidents and heart issues, people will not have access to care. So overall excess deaths in this country have risen above coronavirus. This isn't just about coronavirus. It is about those other patients too. And if they don't have access to care, our mortality goes up.
Okay. Doctor, I wanted to ask you as well, in your hospital, I know that there's been a lot of discussion about who is getting really sick with coronavirus, right? And we know that the death rate for people 19 and under is very small here in Arizona, but are you seeing patients who are very sick under 18?
That's very unusual. First of all, we're not a pediatric hospital, but most of the patients that do get sick have multiple comorbidities and are elderly. That is an accurate statement, but they do it doesn't make their lives any less valuable, right? And they do take hospital beds away from us.
And then do you see some people in the 20 to 44 range that are very sick?
Yes, yes, but most of them go on and get better. We have been improving with therapies. We want to be able to give everybody the best therapies. Some therapies are limited, and we can only give them to the sickest. And there's criteria that people get. So, the question is overwhelming the healthcare system. If we can't take care of patients, we can't get you better.
Okay. Okay. Let's talk about vaccine for a little while. I know that the governor yesterday talked about that vaccine will be here in Arizona as early as mid to late December. They believe it's going to arrive, that there'll be several, the state health director said in the hundreds of thousands of doses will arrive in the first few batches in December. And that those initial doses are going to be given to healthcare workers, people who are in like assisted living, nursing home facilities, those kinds of things, people who are at great risk, and educators as well. First of all, people are worried. Some people are worried about, does the vaccine work as well as people are saying that it works, as well as what are the potential side effects? Should people be worried about it? I know people personally who are afraid to take it. Dr. Will,
do you want to speak to that? Oh, go ahead.
Yeah, go ahead.
Okay. So the vaccine has been given in trials to about 70,000 people, and there's been no serious safety signals. Okay. Now with COVID, about 1 in every 50 people right now that test positive with COVID die. Okay. 0 people, well, actually 1 person died in the clinical trials, but that was a person that was actually got COVID and he was in the placebo group. There have been no serious safety signals. If the FDA approves it and the data shows 95% efficacy, it's really a path out of the pandemic. We would strongly encourage people to take the vaccine. We think it's based on the data and regulatory bodies approving it. We are highly encouraged by this. This is a way out. So we are strongly going to encourage people to take the vaccines.
Will, were you about to say?
Yeah, so I can't add anything up to that. I'm super impressed with the research scientists that worked on this. I mean, the most talented people in the whole world have been working on these vaccines for the last many months. And kudos really to the federal government, both and the European democracies, for funding this research and making it happen so quickly by removing the financial barriers that slow down the system of vaccine production and development, R&D, and so forth. The FDA's advisory committee is meeting on the Pfizer vaccine on December 10th and on December 17th for the Moderna vaccine. They are already looking at those phase 3 trial data, so they're studying that now. I will say this, that those committees, the FDA's advisory committee, those are very independent, extremely talented research scientists, academics, epidemiologists, clinicians, respiratory physicians, etc., that are reviewing that data. And I trust the committee. And if they make a recommendation to authorize emergency use to the FDA commissioner, that's something that I will trust. And they're counting, I think the governor and health director were counting on the FDA advisory committee recommending emergency use of the Pfizer vaccine on the 10th. And that would be those initial doses that would come into Arizona, as Kara suggested yesterday at the press conference. My opinion is that I think those very first doses should definitely go to assisted living and skilled nursing facilities, both to vaccinate the staff that work there and to the residents of those facilities, followed by the healthcare workers within ICU that treat and help treat COVID-19 patients, both ICU trained nurses, ED physicians, and so forth. And I didn't hear anything that was inconsistent with that line of thinking. You heard a lot of talk yesterday about teachers, and I support that as well. But I see that more as a late January, February type population, whereas we've got to get a handle on the influx of patients from these congregate settings. And that will help alleviate some of the pressure within the hospital system as well. The other thing I'll stop talking, is that what we've seen, at least what we've been told with both the Pfizer and the Moderna vaccine, is that the folks who got the vaccines were immunized, which means they had the antibodies, the neutralizing antibodies to prevent serious disease 7 days after that booster shot. So that means within 1 month, if we start vaccinating people in assisted living and skilled nursing facilities, we could have them with some level of pretty good protection within a month. And I'm talking about the staff too. So I'm glad we're talking about vaccines, because a lot of this is really scary. But the vaccines are really the light at the end of the tunnel, and that tunnel is coming up pretty quick. So kudos to the researchers that worked on this so diligently across the world.
Thanks, Will. I wanted to get to this question from Dawn Steele Shepherd, who asks if she'll need a referral to get a shot. Do we know how it works for most people? I know the medical workers are generally going to get the vaccine administered at their hospitals, but what about regular folks when it comes down to them?
Well, I'll just be real quick about that. What I expect to see is what we've done traditionally in public health, is that the county health departments and the state health department will issue what's called a standing order. And what that means is that people won't have to get a prescription for the vaccine. It'll be ready once which removes one of the barriers among others. And I heard that the governor was going to fund and make sure that the vaccines are free. That's another important barrier. So I expect there to be standing orders, and I'd be curious if there's any other approach, but I think that's probably what it'll be.
Okay. Let's just have everybody say the last bit of advice, or the biggest thing that they think that our viewers should be hearing about today, starting with Garrett Archer. Just a 15, 20 seconds of what the most important takeaway you think is today on coronavirus.
One of the interesting things we're seeing right now, again, is obviously this increase in cases, starting with that 10,000 report that we saw a couple days ago. And again, for anybody who doesn't watch us on a regular basis, that 10,000 was actually spread apart for a lot of days, and not just 10,000 in one day. So just important there. But really, what we are now coming into the part of the where we are going to see what that Thanksgiving holiday really did, and what it did to the case numbers here, and what that's going to do to our hospitals. So that's really, we're coming up now to see what these numbers are like, and it's going to be interesting to see where they go. And that's what we should be watching, because it's going to impact everything as far as hospitalizations and deaths as well.
Doctor?
Ooh, we're both doctors.
Well, mine's an honorary doctorate from U of A. That doesn't count.
I will tell you this from our Honor Health medical staff leadership. We are pleading with the public. The governor has put it on the public in responsibility. And we ideally don't need the government to tell us what to do. We have our own, thoughts and about things. And we're telling you as medical experts, please just do the things that we're asking you to do. The governor said something interesting yesterday during his conference. He said, stay if you're ill. But we know this virus spreads even if you're not ill. It spreads the day or two before you become ill. So we're asking you to stay home. If you want to go out to eat outside, don't eat indoors. We know how the virus spreads. Wear a mask indoors, and hopefully this will be behind us in a month or two.
Okay. Thank you very much, Dr. Durrani. And Will Humble.
I think Dr. Durrani hit it right on the head. Stay out of harm's way for the next several weeks. The vaccines are coming. That will take some pressure off of the hospital system. It's just really important to you and your family to try to stay out of hospitals for the next couple of months. And the way to do that, one of the ways to do that is to avoid getting infected with COVID-19, and that directly relates to your individual behavior and the choices that you make when you go out into the community. And I know there's a lot of essential workers that can't make those choices, and healthcare workers as well. They have to go into work, and just do the best you can to protect yourself and be diligent. But there is light at the end of the tunnel. I'm confident that these vaccines will be both safe and effective, and it is our pathway to back to having a normal life. And the last thing I'll do is just thank, honestly, Garrett, for your work holding the state health officials accountable to making sure that the data that they put out is accurate, and really to the entire Arizona press corps. I think this has been a terrific effort by all of you guys in the media to really do a deep dive into what our state health officials are saying and give the people of Arizona an honest view into the real truth. And I just really appreciate the efforts you've gone to do that.
All right. Well, thank you very much, Will. Obviously, our thoughts and prayers are with the people who have been going through COVID, with them and their family members, their loved ones. And we hope that this has provided some advice and good information for people who are trying to make decisions about how to go about their lives for the next few weeks during this holiday season. And thank you to all of you.